There's a silent thief among us quietly, invisibly. It steals strength from within. Osteoporosis. A global health challenge affecting millions, yet so often overlooked. Every minute, somewhere in the world, someone suffers a life-altering fracture caused by this silent disease. But behind every fracture was a warning sign, a whisper of weakness we can now detect and defeat. Today, we unveil the silent truths of osteoporosis and the powerful steps we can take to protect and rebuild strength from within. Let's uncover how we can protect, strengthen, and transform lives one strong bone at a time. Understanding osteoporosis. Osteoporosis is more than just low bone mass. It's a progressive weakening of the bone's internal architecture, making fractures far more likely. Diagnosis is anchored on DEXA scanning. A T-score of -2.5 or lower marks the threshold for osteoporosis, according to World Health Organization standards. The condition often develops naturally with aging, known as primary osteoporosis. However, secondary osteoporosis, triggered by underlying diseases, hormonal imbalances, or medications like long-term steroids, must not be overlooked. Behind every case lies a unique story, and personalized care is the cornerstone of effective management. Classifications. Osteoporosis is classified into two main types. Primary osteoporosis includes postmenopausal osteoporosis, driven by estrogen loss, and senile osteoporosis. Secondary osteoporosis occurs when an underlying condition like long-term steroid use, hyperthyroidism, or chronic kidney disease weakens the bones. Recognizing the type is key to providing the right treatment. Symptoms and signs. Fragility fractures happen with minimal trauma, even a simple fall. Common sites include hip fractures, vertebral compression fractures causing back pain and height loss, and wrist fractures like Colles fracture. Loss of height and a stooped posture. The classic dowager's hump signal. Hidden bone weakness. Early recognition can protect strength, mobility, and independence. Risk factors. Some risk factors are written into our biology. Age, female gender, and genetics are things we cannot change. But many risks lie within our power to influence. Smoking, excessive alcohol intake, low calcium and vitamin D levels, and a sedentary lifestyle all weaken our bones, and these battles can start today. Medical conditions such as long-term steroid use, thyroid dysfunction, and chronic kidney disease silently accelerate bone loss, often without symptoms until a fracture occurs. Recognizing these risks early and acting decisively can mean the difference between resilience and frailty later in life. Diagnosing osteoporosis. Today, diagnosis is no longer guesswork, it's science. The DEXA scan provides a crystal-clear snapshot of bone mineral density, allowing us to detect osteoporosis even before the first fracture. The FRAX tool goes a step further, estimating a patient's 10-year risk of fractures, blending clinical risk factors with bone density results. Targeted blood tests, including calcium, vitamin D, parathyroid hormone, and thyroid profiles, help uncover hidden, treatable contributors. Silent spinal fractures, once easily missed, are now detected early through vertebral fracture assessment during a routine DEXA. Armed with these advanced tools, we can intervene earlier, tailor treatments smarter, and protect bone health more effectively than ever before. Treatment strategies. The cornerstone of osteoporosis care starts with rebuilding the basics, strengthening from within. Every day, calcium and vitamin D lay the foundation for healthy bone renewal. Weight-bearing exercises like walking or resistance training activate the body's natural bone-building processes. Lifestyle choices matter. Smoking cessation, minimizing alcohol, and creating a safe home environment reduce the hidden risks of falls and fractures. Pharmacologic therapies build on this foundation. Antiresorptive agents like bisphosphonates and denosumab help halt bone loss. For those who need more intensive repair, anabolic agents like teriparatide and romosozumab not only slow loss, they actively stimulate new bone formation. And most importantly, no two patients are the same. Personalized treatment plans ensure the right interventions at the right time for each individual's needs and risks. Through a combination of lifestyle, medication, and vigilance, we can preserve strength, mobility, and independence for years to come. Recent innovations. The field of osteoporosis management is rapidly evolving. Romosozumab, or Evenity, targets sclerostin, a protein that limits bone formation. By blocking sclerostin, it boosts bone growth while reducing bone loss. It's especially effective for postmenopausal women at high risk for fractures, increasing spine and hip bone mineral density, BMD, and reducing fracture risk. Its unique dual action not only builds bone but also protects it. Long-term safety of bisphosphonates. Low-risk patients might consider a drug holiday, a planned break from therapy to reduce rare risks like atypical femur fractures or osteonecrosis of the jaw. This helps balance benefits with safety. For high-risk patients, continuing bisphosphonates or switching to treatments like denosumab ensures ongoing protection. Anabolic agents. For severe osteoporosis or multiple fractures, anabolic agents like teriparatide and abaloparatide are key. They stimulate bone formation and are often used in sequential therapy, starting with anabolic agents to build bone, then switching to antiresorptives to maintain those gains. New imaging techniques. New imaging tools like HR-pQCT and MRI provide a detailed look at bone microarchitecture, offering better fracture risk prediction and refined osteoporosis management. These technologies help clinicians make more accurate, personalized treatment decisions. Osteoporosis doesn't have to define aging. With early assessment, personalized care, and regular follow-up, we can protect strength, independence, and quality of life. Strong bones build strong lives. Talk to your healthcare provider about protecting your bone health, because investing today means securing your freedom tomorrow. Osteoporosis may be silent, but we no longer have to be. With early action, targeted strategies, and advanced treatments, we can change the story. Act early. Stay strong. Stay resilient. Take charge of your bone health. Consult a specialist today. Your future strength begins now. Thank you for watching. If you found this valuable, please like, subscribe, and share. Let's build stronger, healthier futures together.